Benign disorders of the ovaries and oviducts are common, especially in women of reproductive age. These conditions can present with a variety of symptoms, including pelvic pain, menstrual irregularities, or may be asymptomatic and discovered incidentally on imaging. Functional cysts are the most common type of benign ovarian lesions. They usually occur in women of reproductive age and often resolve on their own. There are three main types. Follicular cysts. These develop when the dominant follicle fails to rupture and release the egg. Corpus luteum cysts. These form when the corpus luteum fails to regress and instead fills with fluid or blood. Theca lutein cysts. These are associated with elevated levels of human chorionic gonadotropin, or HCG, as seen in molar pregnancies or multiple gestations. Most of these cysts are asymptomatic, but some may cause pelvic pain or menstrual irregularities. Management is usually conservative. A follow-up ultrasound is done, as most of these cysts resolve within 6 to 8 weeks. Benign ovarian neoplasms are true tumors of the ovary not related to the menstrual cycle. Common types include serous cystadenomas, thin-walled and usually unilocular, mucinous cystadenomas, large, multilocular, and filled with thick mucinous material. Dermoid cysts, also known as mature teratomas. These contain various types of tissue such as hair, fat, or even teeth. And fibromas, which are solid benign tumors that can be associated with Meigs syndrome, characterized by ascites and pleural effusion. Symptoms may include abdominal distension, pelvic pain, or a sensation of fullness. Management typically involves surgical removal, especially if the mass is large, persistent, or symptomatic. Ovarian torsion occurs when the ovary twists around its supporting ligaments, cutting off its blood supply. It's often associated with a cyst or mass larger than 5 centimeters. This is a surgical emergency. Patients usually present with sudden onset, severe unilateral pelvic pain, often accompanied by nausea and vomiting. Prompt surgical intervention is needed to untwist or remove the affected ovary. Endometriomas, also called chocolate cysts, are ovarian cysts formed from endometriosis. They contain old, dark blood. Symptoms include chronic pelvic pain, painful periods, pain during intercourse, and sometimes infertility. Management includes hormonal therapy or surgical removal if the cyst is large or symptomatic. Hydrosalpinx refers to a fallopian tube that has become dilated and filled with fluid, usually due to previous pelvic inflammatory disease. While it may be asymptomatic, it can cause pelvic discomfort and contribute to infertility. Management includes surgical options such as salpingectomy or salpingostomy, particularly in women seeking fertility treatment. These are benign cysts located near, but not arising from the fallopian tubes or ovaries. They are usually asymptomatic, but can sometimes cause pelvic pain or even torsion. Small asymptomatic cysts may simply be monitored. Larger or symptomatic ones may require surgical removal. A tubo-ovarian abscess is a serious complication of pelvic inflammatory disease. It consists of a pus-filled mass involving both the fallopian tube and the ovary. Symptoms include pelvic pain, fever, abnormal vaginal discharge, and tenderness on pelvic examination. Treatment involves intravenous antibiotics. If the abscess does not respond to medical therapy, surgical drainage may be necessary. If you found this video helpful, don't forget to like, share, and subscribe for more informative content. Stay tuned for our next video.